The way the law is in America is basically if you present to the emergency department, we're supposed to take care of you the same way whether you have insurance or not. But if you've got chest pain or stomach pain or a fever or you've had an accident and you have no insurance, obviously the only place you could go is to the emergency department. There's crowding problems in emergency departments across the United States. So if you're, say, 10% overcrowded and 15% of them are there because they have no other choice, then potentially you'd have no crowding at all that day, say. So it definitely affects waiting times when you come in the emergency department.
We get people from the emergency room. They're still in the emergency room gown and they'll come to our door because they don't have anywhere else to go. Let's say they have a wound and they went to the emergency room. They don't even have dressings. They don't have gauze. I outfit them with anything we have. We get these donations from the community. As soon as we get it, I try to get it back out there.
I originally had an abnormal pap smear, and then when I went back, because my insurance had lapsed at that point, had ran out at that point, they said go ahead and it's going to be a $200 charge, and I didn't have it. Having an abnormal pap smear can mean a number of things, but it has to be taken care of, and normally it's pre-cancer, and in my case it was pre-cancer. So if I had not done anything, it would have just developed further and further and further.
By preventing, or hopefully preventing, the stroke, the heart attack, the diabetic coma, they don't have to show up in the emergency room. In the emergency room, they have no insurance. Who's going to pay for that? Our community is going to pay for it. Our federal government is going to pay for it. Someone's going to pay for it down the line.
Obamacare tax will cost our business $74,000 a year. We have 67 employees. Obamacare exempts 30, leaving 37. So 37 employees times $2,000 equals $74,000 per year. I think that's the wrong solution for America. I think there's some good aspects of it. We want quality health care for our people and our families. I don't think that the government takeover of this system is the answer.
My dad had a stroke in 2008, and he was paralyzed in 3 limbs, and there's about 100 days where you get the state-funded, Medicare, Medicaid. There was a 100-day limit on his care. I watched how the system destroyed my family bit by bit, and I've watched us sink into poverty deeply. Meanwhile, we have millions of dollars of bills now. We have, when he died last year, almost $20,000 we owed to the nursing home. Even when my dad was there, my mom was only able to pay $100 a month pretty much. And they were sending us some pretty nasty bills then, and kind of trying to threaten to kick him out then when he was still there. And every day she'd be like, I got another letter, oh my God, oh my God. It was like a day-to-day thing of where's he gonna go? What's it gonna be? And how are we gonna pay for this ever?